I feel being a female, being an ethnic minority, and also being unsure about my sexual identity create a lot of barriers for me to access health services. If you're homeless or trying to get information, it's very difficult. In my 29 years of experience, I've probably been heard by a health professional once. It's really difficult getting them to take it seriously. All they want to do is just throw medication at the problem. My thoughts and feelings should be important. I feel confident in my ability to describe what I'm trying to achieve and also what I think would make the situation better for other people. But when you are part of a marginalized group, your voice becomes less and less clear because it gets muddied in with everyone else.
I was in supported accommodation and my son couldn't stay with his mother anymore. I spent 3.5 years sleeping on the floor while he stayed with me and went to school. And he knew this, but I couldn't communicate it. Accessing services was not a problem. They were seeing me, but the service I got wasn't great. I think because I wasn't a problem, I was so quiet, I got pushed to one side. I was in such a bad place I couldn't talk. I was incapable of speaking and standing up for myself or talking to someone. I couldn't look them in the eye or anything. Different personalities use different methods to try to get their message across. Some good, some bad. Personality should have nothing to do with it on both sides. You should be governed by needs.
I know I'm on a time limit. I know I've got 10 minutes. There are moments where I've felt that I've been asked questions directly to me, where boxes have been ticked. Then as soon as there's been enough ticks, they say, all right, yeah, I know what to do. This is what we're going to give you. And I'm kind of mid-sentence and it's kind of, but I haven't finished telling you yet, because all I've done is given enough evidence for you to decide what it is that you're handing to me. But it's not maybe actually what I want, because I haven't had the time to be able to understand. Medication's not really the best route for me, being a recovering addict. Knowing that someone heard me, knowing that maybe I didn't quite get the answers I wanted, but somebody did listen, that's so important for me. I think the handcuffs that a lot of professionals are tied to, if we could just give them a set of keys to unlock some of those handcuffs, I think we'd see a lot better system.